Hello and welcome to the Mod Pod, where we talk all things moderation in drinking and alcohol consumption. My guest today is Dr. Brittny Howell, and Dr. Brittny is a board-certified vascular surgeon and owner of Morph Med Spa located in Ridgefield, Connecticut.
Hey.
So welcome. Thank you for coming.
Of course. Thanks, Jillian. Thanks for having me.
So you're a vascular surgeon,
Yes.
and now you own a med spa. So
Yes.
how did you go from one area of medicine to something a little bit different?
Sure. So I had always wanted to be a doctor since the time I was 5 years old. And then, not really knowing much about medicine, I decided to be a surgeon. So I got really good advice early on to choose a career that really had a background that you could appreciate and always find interesting. So really when it comes to how the body actually works. So vascular surgery, while it is surgery, it's really focused on the metabolism in the body and then how that affects your organs. But that's being carried by your arteries and your veins. So I went through my training. I was here in Connecticut practicing for the largest group of vascular surgeons in the country for 5 years. And it didn't take too long for me to start to become pretty dissatisfied with it.
Okay.
It was just less fulfilling than I had imagined, honestly. And that was never about my taking care of patients. I take care of patients now and I love it. But it was really about being in an insurance-based practice.
Okay.
And feeling very much like a hamster on a wheel, feeling like I was never working hard enough, long enough, billing enough. And I eventually chose to work a little bit differently. So took a break for about a year and a half. I have 3 kids, so that ended up being over the beginning of the pandemic, so it worked out. But again, I really do love taking care of patients. So I had to figure out a way how to do that, leaving insurance out of it and really being in charge of my patients' care. So then that led me to found Morph Med Spa.
So that makes sense because I have seen you in action at work a bit. And in my observations, you are absolutely patient first. You're so warm, and I can see how, like, in the setting of like the surgery and dealing with insurance, how you wouldn't really have maybe as much time as you would want to spend with your patients.
First of all, thank you for that.
Yeah.
I really appreciate that. And yes, I just remember feeling like I was, again, never doing enough, feeling I was pulled in multiple locations at once. And honestly saying to my boss one time, I can only take care of one patient at a time because there would be someone on the phone and then someone's at the front desk, but then someone's in front of me in the exam room and I've got someone waiting for me at the hospital. And it just never felt like I was doing enough. And yes, now I'm not ruled by that clock in that same way. So I just get to be with my patients, which feels good.
So the first time we met was several years ago, probably 3 years ago, I would say, in town at an event. And as I was explaining to you that I was a sommelier, I did wine tastings, I work in the wine business and hospitality, and you were so gracious, but you're like, oh, I don't drink. And I was like, what? I was very much into wine, and I still appreciate wine. I love it, and especially the craft artisan wines. But I was like, I don't understand why would someone just not drink?
Sure.
And now I find myself drinking rarely, and I have never felt better in my life. So what sort of led you on the path to decide one day, no more alcohol?
Sure. Well, thank you for asking. So first of all, I'd like to say I made a significant change in my thoughts around alcohol. So when you and I had that conversation, I was not drinking, but I had been a drinker. I was a self-identified red wine girl. I really enjoyed a glass of red wine, so I never stopped thinking it was tasty or an enjoyable experience. And I probably started drinking more over the course of the pandemic, probably partially because of all of the changes that were going on in my life, but again, also because I did enjoy the practice of drinking. And I just remember one evening, I was cooking dinner for my family, And I had recently started the habit of drinking while cooking, which I had never had before.
It's a fun one because I used to do it, but it doesn't serve. It doesn't serve.
Yes. So I think I had started realizing, oh, this is new. You didn't do this before. And I had a glass of wine. I had a second glass of wine. And I just remembered looking at the bottle and thinking to myself, I could finish this by myself, no problem. And I didn't like that feeling, honestly. So for me, that was the biggest signal. But then I got to really be honest with myself and understand more of the data around alcohol. And then those were secondary reasons because I really do want to be my healthiest self. Yes. And I really do want to be on this earth for a long time.
Yes. So, I did have an experience of one day, well, really I was trying to cut back and I was unsuccessful in the cutting back for a long time. And then one day I was like, who do I want to be? That was sort of, and it was a similar situation where you kind of saw the situation almost as an outsider, looking at yourself saying, I don't want to be the person that can down a bottle of wine, cook, really before the kids go to bed or whatever,
Exactly. Yes.
And I saw myself like, man, this is a challenge for me. I need to find ways to sort of fill the void. And I started just drinking healthier drinks in place of it. And it was, for me, it ended up being just having something refreshing in my hand. Worked extremely well. And then I had some other practices like meditation that also helped. But anyway, so you made that decision. And after you made that decision, did you just cold turkey stop drinking?
I did. So that was December 30th of 2021.
The timing.
I know. And it's so funny you say that because I remember thinking, oh, just push it off a day.
Yeah.
But so I did have a drink December 30th. So I consider, December 31st my first alcohol-free day, but I did not ring in the new year with a drink. And then that was it for me. I realized, to your point of who I wanted to be, I didn't really want to be someone who moderated. I think we can even talk about, is that something you can do with an addictive substance? Yes. But I realized I didn't want that to be part of my life any longer. And again, not because it's not tasty, not because it's not an enjoyable practice, but because I didn't like who that person was becoming.
So now, the Surgeon General's warning was just released several weeks ago.
Yes.
And, when my first reaction was, the statement of the link to cancer, my first reaction was, well, who doesn't know that ethanol causes cancer? I'm like, I thought that was common knowledge and we all just ignored it because we wanted to drink, right? I'm like, well, everybody knows. And then when I looked a little bit deeper, I believe it was only 40% of Americans were aware of that connection.
Yes.
And I was like, wow, I had no idea.
Yes.
So now, what are your thoughts on the warning?
I fully support the warning. I think it's been a long time coming. Honestly, I think it's late. I think we're in a space where we can think about alcohol in the way that we've learned to think about cigarettes. And it's so funny, whenever I think about that, I think back to Mad Men, that television series.
Yes.
Don Draper.
Yes.
And how that was a massive shift in the society's understanding of cigarettes, how cigarettes were just part of society and smoking was a very accepted, normal activity. And then we had to teach ourselves, society, that it was dangerous. And we labeled cigarettes as such. I think we're in that space now with alcohol. So I'm fully behind it. I think we're probably late to do so. And because of the reason that you said, yes, it's something like, 40 to 50% of Americans were unaware that it is actually a carcinogen.
Right. I did not know that. I'm still surprised about that. But it makes sense. Not everybody's, going online and doing research because ignorance really is bliss.
Sure.
Isn't it?
Sure. And I wonder too, I don't know this, but I wonder if people really sort of limited that understanding to the liver, because we, I think, very much understand that alcohol affects liver health and can cause cirrhosis when it's in excessive quantities and then maybe liver cancer, but that there are really so many cancers that have an association with alcohol. I think people did not understand.
And I also think typically people think of cirrhosis being linked to someone who's having 5 or 10 drinks every day.
Sure.
And really, I don't know the statistics to say that, but I'm sure it's actually more common than we think.
Absolutely. Yes. I think that's a really good point too. And so even to change the conversation around alcohol from one of abuse or addiction, and then more to one of health or wellness, that if you're stepping away from alcohol, doesn't mean that you had a quote unquote problem with alcohol. It just means that you're acknowledging that alcohol is a problem.
Right. And I think that more people are getting comfortable having that conversation publicly, and and I also want to be clear that there's a difference between alcohol use disorder and somebody who is able to cut back to a point where they moderate to whatever it is that they're comfortable with as well, or they choose to not drink at all and abstain completely.
Yes.
So we do have to be responsible and mention that if someone may have alcohol use disorder, that of course they have to consult a professional for help.
Absolutely.
So what are the actual cancers that are correlated with alcohol consumption?
Okay. Yes, so outside of liver, if you kind of think about our bodies as a tube, like basically like from the mouth to the anus and then completely being connected, that entire tube is associated with alcohol and its risk of cancer.
Because it's physically passing through.
Correct.
Okay.
Yes. So that means the mouth, the throat, the esophagus, the stomach, the small and large intestine, so that means the colon, and then the rectum and the anus.
Really?
So all of that, yes.
Wow.
Then outside of that is breast cancer, which I think particularly women, when we're thinking about being unaware of the danger, have not been told enough. We have so much awareness in general around breast cancer.
Right.
But I think too few women understand that in comparison to a woman who consumes 0 alcohol, that a woman who consumes 3 alcoholic drinks per week or more has a 15% increased risk in breast cancer.
That feels significant. Yeah. And 3 drinks versus what many people are having in a week. I'm curious about, I was having definitely more than 3 drinks a week.
Sure.
Right? I would have 3 drinks on a Saturday.
Sure.
So multiply that, and that can get kind of scary.
Absolutely. And thank you. That's a great note, because when we're sort of speaking in the medical community about what a drink is, it is likely smaller than what we're typically serving, right? So that means either an ounce and a half of liquor, so a shot, but a true shot, or a regular beer, so a 12-ounce beer, or a 4-ounce pour of wine.
See, the standard pour now in the higher end restaurants is about 5 ounces.
Sure.
And we used to do 6 where I worked. And even in a place I worked was 7. And then there's the country club pour.
You got
which
it.
you may be familiar with.
Yes.
And that's like probably 12.
Yes.
So,
Yes. Absolutely.
Yeah.
Absolutely. So I think keeping that in mind is important too, because you're so right, particularly when it comes to wine, a 4-ounce serving is rare. But that is what we're considering a serving when we're talking about 3 drinks. So it would be 3 4-ounce drinks.
Wow,
yes.
That's not much. So that's actually half a bottle for those who may not know ounces the way I do.
Yes, thank you. Perfect.
But half a bottle, it's about 25 ounces in 1 bottle of wine.
Yes.
So, all right. So now, so the breast cancer. Now, how else does alcohol affect the body negatively aside from cancer?
Sure. So outside of that, for me, was something that's near and dear to my heart as a vascular surgeon is the heart disease risk. So heart disease is the number 1 reason that Americans die. So, and I should say specifically American adults.
Okay.
So, and it's heart-related issues like a heart attack or stroke specifically, that then therefore lead to death. Drinking alcohol increases your risk of heart disease. So things short of a stroke or a heart attack are things like high blood pressure, high cholesterol, all of those things eventually change your risk of heart disease,
Okay.
which then change your risk of having a stroke or a heart attack.
Okay. So does alcohol contribute to high blood pressure as well? Okay,
Yes.
it can. So, Dr. Brittny, would it be accurate to say that alcohol would both directly and indirectly affect whether or not you might have a heart attack or stroke? Because it could increase your blood pressure, and that could also increase your risk of having a heart attack or stroke?
Yes, absolutely.
Okay.
And then I think just to drill in on that, the number one cause of death of an adult American is heart disease. So we are potentially just increasing our probability of earlier death by drinking.
Okay. There are so many great options if someone wants to cut back.
Yes.
And so I've really gotten into the world of alcohol-free wines, mocktails. There's so many great products on the market. I started tasting about 3 years ago, and I wasn't super jazzed about the wines in particular, but really coming back, and the market has changed so much. There's more awareness and there's so many more producers, and the technology is improving as well. And so there's a lot of wines now on the market that I really do enjoy. And also the ready-to-drink cocktails are great, or should I say mocktails. But the flavors are evolving. They're more sophisticated. There's more interesting herbal and bitter elements. The sugar's been brought down, either, the use of just natural sugars or fruit juice sugars, or, they taste more like a cocktail, just kind of without the heat, right? And I definitely notice the more I experiment at home, that the more I'm away from alcohol, my palate has really changed.
Yes.
And so now when I have something, I'm appreciating this alcohol-free beverage for what it is on its own, not as a comparison to something else, because it's never going to taste the same.
That's right.
Like, you can replicate flavors and aromas, but you're not going to replicate the heat.
That's right.
Right? That bite that you get.
Yes.
So I would say for anybody who has tried a few things and they're like, oh, it's not the same. It's not the same. But the more distance you have from alcohol, the more you'll adjust, and then you'll develop an appreciation separate from the alcohol.
agree.
So I definitely recommend people dabble. Get your mixology on at home and play with flavors that you enjoy.
Yes, I appreciate that. And I think, I've learned from you, and I think you can learn from an expert, 'cause I'm certainly not one. I will say for me personally, it did help to have distance. So as I stopped drinking entirely, I didn't immediately look for an alternative. My alternative was more like a seltzer, nothing at all interesting.
Yeah.
But now, 3 years later, I do get to appreciate the complexity of a really fun non-alcoholic cocktail for what it is, and not its comparison to alcohol, as you said. So I think that's really fun too.
Definitely a different lens. And I'm really excited to see where the industry is headed, whether it's something you buy at a store or you go into a bar or a fancy restaurant, and you can order something that's nice listed on the menu with the ingredients. You don't have to ask, like, oh, do you guys make things? And then they're like giving you some sweet garbage and it's not even good.
That's
so,
right.
There's going to be a level of sophistication that's really already happening in many restaurants. And those who aren't doing it, they're the ones kind of like in the dust. They have to start catching up.
That's
I
right.
think so.
That's right.
Anyway, if you're in the restaurant industry,
It's true. And I have to say, it seems like the younger part of our population is really helping with that. Like, the so-called, I am technically Gen X, I'm 44. I think Gen Z is really helping with that. They are less likely to drink than my generation is. And they are then therefore demanding that of the market, which I think is really exciting.
Yeah, that's great. And it's shocking, because I would never have guessed if, 5 or 10 years ago, that the young people would be the ones to change the narrative here. And, they may be leaning more into like the cannabis infused products, which is a possibility as well. And I also think that the recreational use and medicinal use is sort of giving people an alternative to just the sort of sense of calm that they may be desiring. And certainly that's not for everybody, but it is something that is sort of also giving people an alternative. It is, right? Absolutely. And it is changing how people are making choices in the market, right?
Yes.
So we talked about heart health. Let's get back on track with how alcohol affects the body.
Okay.
So we know cancer and heart health. How are some other ways that alcohol would negatively impact the human body?
Sure. So after heart health, I would say the next big one is brain health. So specifically, if you think about the brain, it's a combination of what we call white matter and gray matter. And so alcohol diminishes both of those. So we can see in someone's brain who is an active alcohol drinker that they have less of both. They have less white matter and less gray matter.
So wait, it physically is reduced?
Physically shrinks
Really?
the brain.
It shrinks?
Yes.
That is crazy.
It's wild.
Okay.
It's wild. And so then, sort of going further along that is one definition of dementia, when your brain is physically shrinking. There are lots of different types of dementia and sort of subcategories, but less brain matter is one way that someone can present with dementia.
Wow.
And so by abstaining from alcohol, you can preserve your actual brain matter and stave off dementia.
Wow. And so I have heard of a person that in my life who was diagnosed with dementia as a result of the overuse of alcohol.
Okay.
And so I'm wondering, when that diagnosis was it made by actually a scan, or was it made in just, talking to someone and giving, I guess, like a narrative of that person's life?
So probably that person, I have no idea, but probably that person had an actual CAT scan, an actual CT scan of the head, because that is the best non-invasive way to actually get an idea of the volume of the brain. And especially, so it's ideal if you can make a comparison, like from an earlier scan to a current one, but you can also just see that within the skull cavity, that the brain does not take up as much space as is typical.
I just can't even fathom like how the brain would then, like, do the cells die and then it's just eliminated by the body?
Correct.
Really?
Yes.
Wow, that's terrifying.
It is, actually.
Oh my goodness. All right, so please stop drinking, everyone. No, it's terrible.
Should I make a pun? It's very sobering.
Oh yes, it is sobering. That's great. I love it.
It's true. It's true. Now we have to lighten it up a little bit, but no, it's a challenging topic to discuss, I think, especially with friends, with family, for me, with patients, because again, it is such a big part of our society that you're a little bit of a party pooper if you're out and about with someone over the weekend, and then you want to talk to them about their brain health and the cocktail that they're enjoying. So it's something that we really approach quite gingerly, but that's again why I really did appreciate the Surgeon General's warning, because people deserve to know this information, and we can't be overly concerned about how palatable the information is. People really need to make informed decisions about drinking.
I was really shocked when that news was released, because the power of the alcohol lobby in this country is unbelievable. And somebody who's worked in the industry, and then, there's the 3-tiered system and lots of dollars. So I couldn't believe that it even got to the point where it did, where this news was spread out to the masses.
Yes.
And so it's actually really exciting.
I agree.
Because people are becoming, more aware and more conscious, I would say, of the truths that have been kept from people for millennia, really, or should I say centuries at least. Yes. So I'm really excited about that, and I think people are going to make better choices for themselves and for the planet as well.
I completely agree.
So the last thing, I wanted to ask you, does alcohol affect like hormones or the endocrinology of a person at all?
It does, yes, and maybe in some ways that are not so obvious. Okay. So I think a lot of times when we hear the term hormone, and everyone's different, of course, but I think there are a few that immediately come to mind. Right. So I think, thyroid hormone is right up there, particularly for women of a certain age. I think estrogen really comes to mind quickly. But we've got thousands of hormones that are really just like little messengers, and they're at work all the time, all over our body. So for one example is that alcohol really changes your sleep. And it's something that is hormone mediated, and it's something that if you take a moment and reflect back to maybe a night after drinking, you know that, or you know that it's true. Yeah. But the reason is because it actually puts you into a lighter sleep, so that you then therefore have less deep sleep. Okay. And then you are more likely to be awakened overnight. Okay. Which makes your overall quality of sleep lower, which has all sorts of other downstream effects. Yes. That is partially hormone mediated. Okay. It also does change your gut. You know, again, sort of thinking about that tube, your body being that tube again. And there are lots of hormones being released from your gut or coming from your bloodstream into your gut, and then vice versa, from your gut to your brain and vice versa. And alcohol changes all of those. And so it really does change your ability to digest, your ability to pass food and evacuate it from your body as waste. And so, and all of those things are hormonally mediated. Again, they're just the lesser known hormones.
Okay, sure. Wow, that makes sense. And I really didn't realize how it affected even your digestion of foods and perhaps the absorption of nutrients. Yes. Just throwing it out there, but it seems like that would make sense.
Yes, no, absolutely, yes.
Wow, goodness, okay. So I'm learning a lot about this connection with the gut. Is there anything else that we, especially as women of a certain age, might want to know about?
Yes, so alcohol really can change your appearance. And I think, sort of thinking about earlier in our conversation, we were talking about sometimes these are changes that people assume takes a significant amount of alcohol, whatever that is, or an alcohol abuse disorder. Yeah. But really it doesn't. And so you can see really anecdotally when people step away from alcohol that they appear differently.
That is true. Yeah, that is so true. It's like the puffiness or something goes down, right?
Yes, yes. So that is partially because of what we were just talking about and how it changes your gut health, because your appearance isn't just about, you know, what's happening to you on the outside. It's also very much what's happening on the inside. And so that additional fluid absolutely is part of your body's inability to digest and then holding on to that. And then that might show up everywhere, but particularly it shows up in your face. Right. Alcohol is also very drying. So again, it doesn't matter what formulation, whether it's a mixed drink or beer or wine, it's incredibly drying. Okay. And so again, very anecdotally, but we can substantiate this. Oftentimes people will say that they note that their skin is glowing more after they stop drinking. And that's very much a part of the skin being more hydrated from that alcohol being out of the system.
So when someone is drinking a lot and they're sort of puffy, is that like a lymphatic or an interstitial type of thing?
Yes.
Okay.
Yes. Okay. It's very much partially the lymphatic system, which is part of your gut too, right? The lymphatics go throughout our entire body. So now it's very trendy to think about lymphatic massage of, you know, of the body, of the belly, and of the face. But that is happening all over your body, and it is, happening from the gut too.
Okay. Oh, wow. So well, we know it is all connected.
All connected.
And when I really cut back, I would be like touching my face at night, doing my creams, and I actually noticed it was firmer. Like there just wasn't as much between my finger and my bone, my skull. Because it just wouldn't go in as deep. And I noticed, I'm like, oh my gosh, I think that's from cutting back drinking.
Sure.
Just like I wasn't as puffy in the face. So I noticed it right away. And I was like, wow, that's pretty crazy.
Yeah, no, it's great. And I love that you got to see that for yourself. And so it's encouraging, right? Everyone's going to have their different motivation for perhaps experimenting with less. And sometimes we can't deny it. It's going to be the aesthetics, and there's nothing wrong with that.
That's fine. I have no problem. Because you know what? If you're making choices from a purely aesthetic point of view, it's still better for you overall, right?
Absolutely.
So
you get to be encouraged in whatever way works for you. Absolutely.
Fantastic. Oh, well, this was such a fun conversation. It was so enlightening. And I'm really hoping to sort of just spread the word about, you know, nobody's saying anybody should go cold turkey but even just having a little bit less,
Yes.
would you agree that undoubtedly that's going to help you in the long term?
Undoubtedly. And I think that's what, we're recording towards the end of January. I think that's what's really helpful about something like a dry January, a sober October, is that even if you cut back, studies show that that is a long-lasting effect, that you will therefore drink less, even if you continue drinking. So while, again, to echo the Surgeon General's warning, there really is no safe amount of alcohol, we know that the challenges with alcohol are dose dependent. So less really is more.
Yes, definitely. Fantastic. And I'm really hoping that more and more people every single year are participating in Dry January.
Yes.
And that means more and more people are going to give themselves the distance and the perspective to say, you know what, I actually functioned really well that month.
Yes.
I felt amazing. And you know what, maybe I'll just even cut back, like, no weekday drinking. Just,
Exactly.
Maybe Friday, Saturday or
That's
something like
right.
that. And I think that'll really do a lot.
Absolutely.
So, great. Well, thank you so much, Dr. Brittny, for coming.
Thanks for having me.
I appreciate it.
You got it.
All right. See you next time on the Mod Pod, the Moderation Podcast.